Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I wanted to leave you with something to show on orthodontic courses, and we're number 50, how to avoid surgery on a orthodontic case. And that's the double jaw type surgery in there, and I want to cover as much as I can and tell you how we came up with this idea, and it works. Now, if you look at somebody's class 3 case, I mean the lower jaw is standing out in front of the upper jaw like this, and people oftentimes will treat the case by just moving the jaw back, just backing it up. Then you crowd the tongue. The tongue is not used to that, and so they tended to relapse. The tongue would push this back out again. So the better old surgeons worked on both the upper and the lower. So they moved the upper teeth forward, and the lower jaw, they would bring it back some, but they gave room for the tongue by moving the upper teeth forward. Now, I scrubbed in on a case like that, and I saw what they were doing, and I went and tried, can we do that orthodontically, bring this out, where we would bring these teeth back and we'd bring these teeth forward up here. And so, I'm sorry the voice is so bad here today, but what we're going to try to do is actually move these two teeth here. And we decided you take out the 6-year molar on the bottom and you move these teeth up to where they're in. See now the first molar's out under the bicuspids. It is a definite class 3 case. So we want to move these teeth up till they fit right in this area. You go up here. In other words, move it forward about that far. And then what we would do is go in here and hook onto these teeth and pull them back to a certain extent to make them, well, we'll pull them forward, I'm sorry. And we would take the upper teeth here, and we're going to make the upper teeth come out further to the front. So we'll take these teeth and pull them back by pulling forward on the upper teeth. And so we've got space to close here. We want to move these bicuspids back to where they fit in here. And if you need some extra room, you can get these where you want them, and you can put a pin in right in here and bond it to these teeth, and you pull back on this and make this go in a forward direction, doing the same thing that we did, that you do in surgery. Now, this type of surgery, you come in and do that, and you move the jaw forward by sectioning it off and move this out some, and then you move this back, and then you bring this forward. Now, when you do this, in other words, you're going to reduce the space that these teeth have as we pull this back and we move these teeth forward in there. It's going to mess up the whole makeup in here. Now we worked on this lady that I'm telling you about from 7 in the morning till about 1 o'clock that day. and we brought her upper teeth out, and we reduced the height of it. Then we brought the lower teeth back, and we sectioned it and brought it back. And when you put the condyles, and you're going to take this and go, and you're going to go back with it, and you have to do something with the condyles back here as you bring this forward. And so the condyle fitting up in the fossa has to have a big change when you wire the jaw together there. If you do this slowly, the condyle and the fossa will gradually change as you come back with the lower jaw. It'll fit in there better, and then you can bring the upper teeth back. So we show this case, and we think you could come in and do about 80 or 90% of these surgical cases could be done by removing lower 6-year molars. And that's what we wanted to show in this case. We took them out right here, and then we pulled these teeth forward in here, bringing these teeth out. Let me see, I'm backwards in here now. We're going to have to bring these teeth to the front, and these teeth will go back to a certain point, and these come up to here, and that would help us get these out as far as we could, like that, and correct it. And you can watch that take place. And we took the 6-year molars out, and now we are bringing these bodily forward to the fit right in here, like that, and brought these teeth back to where they fit here. So we brought these back, everything, without running these back there. And you can watch them come in here, and their teeth are moving forward as we go. And she's aged 28 and 7 at this point. And this is, I think, about 20 years after we finished. We've lost a little bit of this, but this is where we finished her looking like that. We brought those under, brought this out, and we expanded these teeth with that large arch wire. So here is the lady. This actually is 20 some odd years after we started. But this is 37 years after we did the case, and that's how it looks. Well, this is not the final picture right here. I'm going to show that in the next deal. This is about 20 years out, and then this is in 87. That's about 20 years out, and that's fitting in there like that. Now we found this lady 37 years later. She works for Southwest Airlines. She's got gray-headed, but this is the same lady that this one is, and this is 37 years after the Class 3 problem was solved. And we think doing this type of thing can get rid of a lot of surgery. She had been to a couple of old surgeons, and they wanted to do the upper and lower jaw surgery, but we did not do it. And we know where she is. We're going to follow her, hopefully for many more years, if I live that long. So anyway, I want to hang up and say thank you for watching. And we are trying to do orthodontics in that manner. Thank you again.